Cheerios are 2-year-old Nate Lau's current favorite snack. That may seem insignificant, but it's actually remarkable he can eat solid food. Nate and his 5-year-old brother Jake have a rare genetic condition called epidermolysis bullosa, or EB.
If you picture Velcro, one side is muscle, one side is skin. There's actually hooks that are anchoring into the muscle tissue and holding the skin on. In the form that my boys have, we don't have those. So basically the skin kind of shifts around or it just peels right off.
EB makes everyday life a challenge. Nate and Jake must be wrapped with bandages to protect their skin and allow wounds to heal. EB makes skin so delicate, a seam on a piece of clothing can cause the skin to blister and come off. The risk of life-threatening infections or cancers is so great, few EB patients reach the age of 30.
Eating and drinking is difficult. Anything that goes in their mouth basically causes tissue damage.
But there is hope on the horizon for the Lau family and the thousands of families who share their struggle with EB. A team of researchers at the University of Minnesota has discovered a cure.
It is very unusual to say that you have a cure after just one patient. However, what's extraordinarily different about this particular case is the fact that we've been able to demonstrate by electron microscopy, as also by protein analysis, and also by looking at the patient, that we made a fundamental change. What was not present at all to begin with is now present.
What's now present is collagen 7, the key to the form of EB that affects Jake and Nate. It's a protein that allows skin to hook into muscle. Researchers believed if they could correct the collagen 7 defect, they would reverse the effects of EB. Here's how they did it. Through trial and error, Dr. Jacob Tolar treated mice genetically altered to have EB with different types of healthy bone marrow and cord blood cells. Some of the mice lived, and their blisters cleared up because they were producing collagen 7, the protein missing in the Lau boys.
So once we had the results in the animal model, we had the proof of principle that a cell population from the marrow could correct epidermolysis bullosa. We took that strategy, first proved in the mouse, and then applied that to a clinical trial.
In October of last year, Nate received a transplant of cells from bone marrow and cord blood from his brother Julian, who is a coincidental perfect match and is not affected by EB. 7 months later, Nate's collagen 7 levels are near normal, and his skin is noticeably less blistered.
Before, when you looked at Nate, he looked like his skin was kind of thin. In parts, he almost kind of looked translucent. It appears that that layer that was missing is there.
We truly believe that having now corrected the collagen type 7 deficiency, that he will no longer have that risk of cancer, that he will no longer have the risk of mutilating scarring, that his quality of life will be enhanced tremendously.
To be able to throw them in a bathtub, put their pajamas on and put them to bed would be an amazing thing without having to worry about all of the nutritional needs and the tube feedings and the bandages. That would be an amazing thing.
The hope offered by this cure doesn't end with the Laos. The knowledge gained will allow researchers at the University of Minnesota and elsewhere to explore more disease areas and develop more cures.